Hi, I'd like to take a few moments to talk to you about healthcare. I take 2 minutes with each patient every day to explain what's been going on with this healthcare debate we've been engrossed in over the last year. What you're seeing is our government trying to take over healthcare. And I just wanted to let you know that the rank and file physicians that are out there taking care of you each and every day are adamantly opposed to this. And the reasons why are because we've had experience with government-run healthcare. When we go through our training, we spend years at the VA, a government-run program which is ineffective at treating patients. It rations care, it doesn't allow very much choice, and is relatively poorly run for the most revered citizens in our country. It's not a system that we want to emulate for the entire country. If we take a closer look at other government-run programs, such as Medicare and Medicaid, what we see are trillions of dollars of unfunded liability, and this year, there are fewer people paying into the system than are actually drawing benefits. What a lot of Americans don't understand is that most patients that have Medicare also have supplemental insurance. So right now, a lot of those patients are having their benefits met because of that supplemental insurance. But we're seeing that the system is broke. And eventually, when fewer patients are paying into the system and more patients are drawing benefits, there's going to be only one choice for the government, and that's going to be to severely ration your care. And when they do that, they're going to limit my ability to care for you. We don't want to see that happen, and there are many common sense solutions that we can do to help preserve the greatest healthcare system in the world. Anywhere that government-run healthcare has been implemented, you have seen healthcare costs skyrocket and access to physicians and specialists decrease, and you've seen the quality of care decrease. The most recent example is in Massachusetts. From 2006 to 2009, they've claimed to have saved $268 million in uncompensated care, but at a cost of over $2 billion. This doesn't make any fiscal sense whatsoever. Look, all Americans and all doctors for that matter are for reforming our healthcare system. We want to bring down healthcare costs and we want to be able to extend healthcare to more Americans. But we want to do it in a way that helps us preserve the quality of the greatest healthcare system in the world, and that's the one that we have in this country. If we contrast the Massachusetts plan to what's been happening in Indiana, the differences couldn't be any more compelling. In Indiana, they've implemented health savings accounts. They've allowed state employees to control their own money and use it towards their own health care. And what we have seen in the last 2 years is the state's expenditures have decreased by 11% solely with the implementation of HSAs. When you compare the people on HSAs compared to the people in traditional insurance programs, we find that they have half as many admissions to the hospital. They utilize the emergency room and physician's office visits 67% less often. And for every $100 spent by patients in traditional healthcare plans, the patients on HSAs spend $65. And the reason for this savings is that when people are using their own money to consume healthcare resources, they make better decisions. They decide if they have had that colonoscopy before, or if there is a generic drug that can be just as effective. People, when they control their own healthcare dollars, make logical decisions, and they still remain in charge of their own healthcare decisions. And these are the reforms that we want to see. Another example of healthcare reform that's proven to be effective is tort reform. Prior to 2003, the tort environment in Texas was very unfavorable to physicians. And as a result, you saw physicians leaving the area in droves. And this created a real healthcare crisis in the state of Texas. There were limited access to specialists, and in rural areas, there was little or no access to physicians at all. In 2003, they implemented responsible tort reform, and what you saw was an influx of physicians into the area, which increased access to patients to specialists, and in rural areas, access to physicians in general. It was a tremendous success, and you saw their healthcare expenditures decrease by 30% across the board. It is important for every American to understand that we are at a crossroads right now. The government is trying to take over the American healthcare system. They're going to take away your freedom, they're going to take away your choice, your ability to choose the doctor that you want to see and to make decisions about your own health care. They want to implement changes that have been proven to fail time and time again with government mandates and community ratings. They're creating a scenario that will eventually drive private insurance out of business and lead us to a single-payer system. What the physicians in America want to see and the physicians of Docs for Patient Care want to see are changes and reform that have been proven to work. Tort reform, health savings accounts, competition across state lines. The decision is in your hands, America. It's time for you to stand up and let your elected officials know how you feel. Please help save the greatest healthcare system in the world.